Gifts of love with dread, bringing love for you this year. Communion showing that we care, with gifts of love with dread.
We're bringing you gifts of love with cheer at the communal. This Christmas, we are your Santa. It's all about sharing the warmth of this season with those you love. Get in on this special loan, taking advantage of great interest rates with no principal payments until January 2022. Share the gift of love. Make it a merrier Christmas with the communal. Exciting prizes for members throughout the promotion. For we are your Santa this Christmas. Offer ends January 31st, 2022. Lending terms and conditions apply.
Communion showing that we care, with gifts of love with dread.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen, Guess and Klein and G-Shock, all at the best prices in Grenada. We also buy scrap gold and offer the best deals and customer service on the island. Opening hours Mondays to Saturdays 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit our brand new remodeled store or call us on telephone number 414-3114, 232-1234 or WhatsApp 533-1581. Sale is on for limited time only.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Rich, smooth, delicious, and packed with vitamins that could only be one thing. It's a Rika almond beverage. Great on its own or a lovely addition to smoothies. So call Superb Distributors on 435-2948 or visit us at Tempe St. George's today. Remember, Rika is life and life is Rika.
The Housing Authority offers products that people can choose from, products that people can access, and I think anyone looking to build, just call the Housing Authority of Grenada. The service was superb. Every step of the way, they collaborated with the owner, they collaborated with the builder. The builder himself was really good. For what I've seen them do, I have to say that from buildings they have done in the past to where they are now, they have come up to speed with modern trends, modern designs, and I think I will advise anybody to choose the Housing Authority of Grenada.
Yes. Welcome one and all to another Mikey Live program. I'm your host, Mikey Hutchinson, and we are coming to you live from Grenada. There is now election buzz in Barbados. Will Mia Motley regain her reigns as the Prime Minister of that country? Time will tell, as the tabulations will probably be happening right now, right? We probably will be able to give you an idea as to what's taking place there before we leave tonight. All right, let's see. She's very confident that she will win again. Here in Grenada, we'll be talking about the GFA boy. They set their 2022 agenda. Also, police involved the shooting in Sauteurs leaves one man dead. Over 3,000 active cases of COVID-19 here in Grenada. And the U.S. lists several Caribbean countries among highest risk travel category. Health officials ask people to stop making prank calls to the emergency services. We'll talk about that. And we have a lot more to talk about. Boy, pressure. Them nurses under pressure. You understand? So many people are demanding testing and so on, and there are some who are out because they have been exposed to COVID-19 and so on. It's just a lot happening right now, but we're going to tell you all about that in a while. We got to let you know that the headlines was brought to you through the kind compliments of Coach Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, Real Value IGA Supermarket, and Superb Distributors. Family, we are going to take a quick, real quick break, and we'll be right back. We want to encourage you to please share the program. You see, when you share the program, that's how other people get to know that we are live. So go ahead and share the business, people. Share the thing, no man. Why is that one? We are coming back. Stay tuned.
What does it take to be an amazing woman? Lots of me time. Amazing women are classy, fancy, and a little sassy. It's the drink for me. Cheers! Sometimes you've got to show them who's boss. Alpha male? Nah, alpha females are more amazing. Cheers to securing the bag. We make time for ourselves, for work, friends, and we certainly make time for passion. We're simply amazing. Amazing cream liqueur for the amazing woman in you.
We enjoy the luxury of a quality water supply. But it can come to this. Have adequate storage.
Thank you very much. Have adequate storage. So when water go, all you have all the business, you know what I mean? You're not going to be inconvenienced to any great degree. You know what I mean? Following approval of its 2022 budget, GFA says this year it intends to focus on national teams, women's and youth football. Now, it also intends to place emphasis on coaching education. Now, the General Council of the Association is said to have unanimously approved the 2022 budget with a focus on 6 national teams, including the under-17 women's and senior national men's team, youth development programs, more women's football competitions, coaching education, and the development of a technical center. Now, already, the under-17 women's team has been preparing for the CONCACAF Championship group stage from April 23rd to May 8th of 2022 in the Dominican Republic, while the senior men's national team has a robust calendar of events, including the CONCACAF Men's Senior National League from May 30th to June 14. Now, GFA also says it wants to concentrate on developing more opportunities for meaningful play for low age groups, such as the lower age groups, such as the under 10. You understand? So let's see how that will work out, and then they're trying to be a little more comprehensive in what they do and more targeted. You understand? Okay, cool. All right, cool. Just after we come out on the program last night, boy, the place started to shake. You know what I mean? Mommy! You know what I mean? Yeah, boy, but we will later find that it was a quake that measured a 4.7 on the Richter scale. All right? It affected southern parts of the Caribbean, such as Grenada, Trinidad and Tobago, Venezuela, and so on. All right? Now, the Seismic Research Center, the UE Seismic Research Center, said they got reports on things, you know, and so, you know, not major, yeah, it's not major, but yeah, boy, the place shake up. Yeah, it was in terms of distance from Grenada, 119 kilometers southwest of the capital, St. George is, all right. Yeah, boy, but anyway. We know nothing. We just got a little shake. Nothing too much to talk about. You know what I mean? But everything does happen. And I think yesterday, Barbados had a little ting too. You know what I mean? But anyway, let's leave that talk. Hold you. From the dashboard last night, 239 new COVID-19 positive cases were identified. You know what I mean? Yeah, boy. Yo. Yeah, you see how going on in the place. Now, there were a total of 1,686 tests that were conducted yesterday. Now, that took a positivity rate to 14.2%. All right? At least there were no deaths, according to the dashboard. Now, It's interesting to note, however, that we have passed the 3,000 mark in terms of active cases. When we say active, we're talking about people who are positive or who will be positive on a test, or people who go through the system and were tested. 3,300 and some, according to Dr. Sean Charles.
Yesterday, we identified another 239 cases from just over 1,600 tests. That brought our active count up to 3,346. With regards to positivity rate, yesterday positivity was just around 21% to my memory. But what should be observed is that since the peak, or what we interpret to be peak of the infection a week ago, or just over a week ago, where we identified I think 501 cases in that in a single day, with a positivity rate of 28%. What we have observed since is a steady decline in the positivity rate of cases. While this is encouraging, we cannot lose sight of the fact that we are still in the midst of a particularly intense outbreak of Omicron, and we all need to do our part to ensure that this disease goes away. All right, we all need to do our part to ensure that we limit the number of cases and any possible untoward effect.
Thank you very much. Yeah, thank you very much, Dr. Charles. So that's what's going on. But he's saying, as you've heard, that despite the fact that we're having so many cases, they are still seeing a steady decline. You understand, in the amount of cases. So I would like to think that that's a good thing so far. That's a good thing. I mean, high, but you're getting lower. Higher, lower, super. I remember the dance. Anyway, let's leave that off. So, piece. Grenada is one of several Caribbean countries on the United States Centers for Disease Control, the CDC, highest risk travel category. Level 4 in a dog for the coronavirus pandemic, as countries continue to grapple with the effects of this particular wave. Widespread infections in a lot of countries owing to the Omicron variant. Now, the CDC also named the Bahamas, Bermuda, the British Virgin Islands, Guyana, St. Kitts and Nevis, St. Lucia, Suriname, Malabos, as well as the Turks and Caicos Islands on that level 4 categorization. Now, Grenada moved from the level 2 or moderate risk category, and it had that for a couple of weeks, for a while, to level 4. While the British Virgin Islands had the biggest move upward in the list, moving from a level 1, which is low risk. Yeah, that's that. You understand? Now, the CDC places the destination at level 4 with more than 500 cases per 100,000 residents are registered in the past 28 days, and advises travelers to avoid travel to level 4 countries, which, well, of course, it includes Grenada, Jamaica, Cuba, Saba, St. Bartholomew, who else? And St. Eustace. They're all in the level 3 category. You understand? But you know what? Who cares? You can put us in whatever category you want with a business. Could you imagine people like us have to sit on CDC boards and things when we're coming up with that, Because of course, we should be having a say, but that's not how it works. But anyway, you could imagine if it was so. Yes, and we did anything, and they say, well, okay, as it relates to Grenada will have to be downgraded to category 4 because, of course, it has met the threshold for that categorization. And the Grenadians say, what are you talking about, boy? What are you talking about? Leave the country alone. Law, what's not, boy? Law the country, not Jed. Anyway, like leave that dog there too. All you. The system is going through a period where there is a lot of strain on the nurses and so on. And in addition to that strain, we are now hearing that people are calling the emergency services. For example, they will call the hospital and say, hey, earlier there's an accident in X and Y place, and people look like they're dead and things like that, and then they give the address. Woo, 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 woo. Ambulance and police will arrive. Nothing. No accident, no emergency. Somebody did a prank call. We heard about it, so we asked the doctors and them on the program, the business this morning, as to whether or not there's any truth to that. The doctors and them say yes, that people doing that.
And yes, I can confirm that we have had these prank calls, and it's actually very sad that this is happening in the midst of the pandemic with a number of cases that we have and persons seeking medical care. So I would really like to ask the public to work with us. Please work with us. Think of it like this. Now, if you do a prank call and there's someone, a family member, who actually needs to have that ambulance call, what would have happened is that the resources would have been deployed to an area that is not needed for an area that is actually in dire need of that service. So it means that what would happen is someone who needs urgent care would be deprived of that care because of your prank call. So yes, I can confirm that these calls have happened. And, we're really saddened by that because we're in the midst of this pandemic. We're in the midst of community spread. We have a surge in cases. And, of course, we'd have a lot of our elderly persons who will need care. And, of course, if an ambulance goes, we've had instances where an ambulance would go to a household and the persons there don't have any idea why the ambulance is there. And then you have the other instances where ambulances go out and then no one is there. So we have the two scenarios. No one is there, and the other scenario where the persons within the household have no idea why the ambulance is there. So I really want to ask persons that we should really stop that practice because it's affecting our system, and it's actually deploying a service to an area that's not needed. And persons who really need that service will not get the benefit of it.
Yo, that dread. Dog. I can't imagine. I just can't imagine. So imagine they have two calls and they have to respond to one and say, okay, let's respond to the accident. Let's respond to the one that people say, oh, ting. And then when they show up, so while one is somebody's seriously ill on one end, genuinely, on the other end, when the ambulance reaches there, there's nothing happening. Nah, man. Grenada, we better than that. We better than that. You know what I mean? I'll better stop that. Stop it. Understand? Oh, yeah. So, there's a lot of pressure on the system right now, again, as we was alluding to. A lot of tests. People are coming forward for a lot of tests. The other day, they test 2,000 and something, then 1,000 and something. So, a lot of people are demanding testing services from the General Hospital. And the Chief Medical Officer, Dr. Sean Charles, says that is putting tremendous pressure. Tremendous pressure. He says on the system, especially for the nurses that are remaining.
I wanted to mention in particular the level of the community where the bulk of testing and so on is occurring. The issue of staff challenges shortages is more acute because the community health services, they have many functions. They do the child health, the antenatal, there are routine patient and consultations, there's home visits. There are many services that are offered to the public. When persons fall sick, or when we simply do not have the adequate number of staff to cover all of these services, it puts a lot of pressure on the remaining staff to maintain some level of service. All right. And with the huge demand for testing, I mean, it's putting a lot of strain on our community staff. And, that's why we ask for understanding from the public. When you go to a testing site, and yes, there's a long line. There's a reason for this. If we had a large complement of staff, of course, that line may not be so long. But you need to understand that we are working under, a bit of pressure right now. And, we recognize and we applaud the staff who remain for the amount of work that they're able to put in, because the number of tests that we are doing right now is far exceeds anything that we have done in the past in such a short time.
Yes, okay, so he's asking for a little bit of understanding and empathy where that is concerned. Okay. Audio. I see one of my stories disappearing on me, but anyway, we're moving on. Police are probing an incident that happened this afternoon. You understand? The Royal Grenada Police Force, they have confirmed a police-involved shooting that occurred just before 4 p.m. today at Sauteurs in St. Patrick. According to police, one man died, as a result of a gunshot wound that he received. All right, again, it was the police who shot the individual. And so they are saying that they are doing their investigations and didn't really offer much details in terms of what happened. And of course, there are a lot of things that are being said. But, again, we don't participate in the kind of speculation. And that's how we want to be responsible. So we wouldn't get into that, into what might have happened. But we've had, people calling to us to say, okay, this is what happened, and let's give it some time. Let the police do the investigation, and of course, we will see where we go from there with that. The identity of the individual was also not given by the police. I'm guessing that they'll need some time to inform family members properly, of course, before putting that out there. Let's go to Jamaica for a while. Police are probing the circumstances surrounding the death of an infant girl, listen, after she was left unattended in her father's motor car on the compound of the Black River police station on Monday. Now, a police source confirmed that the child is the daughter of a policeman who's assigned to the said police station. Now, according to reports, the child died in hospital this morning, 2 days after she was reportedly left in the policeman's car for several hours. Yikes. I would like to know what happened. I would really like to know, is it a case where he forgot the child the infant in the car? And these things, you would imagine the kind of death someone suffers in that way. It's crazy. That's one of the ways that and stifling and drowning and dying in heat, like locked in a vehicle. You could only imagine. You understand? Some people feel like they're dying out of claustrophobia. Just being in closed spaces where they could breathe and thing, okay, but they feel like they're dying. Imagine the actual scenario where, you were locked in and, oh my God. Anyway, So yeah, that situation is tough. You understand? That situation is tough. Only how we looking for time. Now, according to weather experts, it doesn't seem that we will be getting a very harsh dry season this year. In other words, what they are saying is we are not likely, and that's just a forecast, right? We are not likely to experience a drought this year. So the dry season, wouldn't be as dry as we have seen in other years where we have experienced droughts and so on. And that's a good sign, because in years gone by, in the past 3-4 years, the dry season don't want to behave. You understand? The dry season don't want to behave because it comes really harsh. So far, 2022 has been relatively wet. You understand? We've been getting rain for the past few days. Well, yeah. And the chilly conditions are noted throughout the island, with residents always going on to social media and expressing how cold it is. And the people in Canada and the US talking about, oh, what are they talking about? Cold, cold, cold. Yo, listen, take all the time. Then people say, cold. You understand? So there are areas that are clocking things like 21 degrees and 20 and so on. I think the lowest that we've had on record was around the 20-21 mark, right? Meaning 20 degrees, 21 degrees mark. Yeah. But who knows? Maybe in a few days we'll experience something colder than that. Yeah, because by the way you go in there, the place cold. These days I'm going to work by after 5 o'clock I'm out the door. But Jesus, the place cold. You understand? Anyway, lady, that talk. How we looking for time? What I want to do, family? I want to take a little break now. I want to take a little break, go drink some water on the program and come back to you with the national report and the weather. And then I'm going to also check to see if we can get something from the Barbados election. I have something up on my screen here. You understand? So if they think working properly, I should start to see some of the areas and which party is leading, if they think working properly. All right, so far I've been checking and I didn't see any results coming in as yet. So let's see how we got to teach them how to do that. The only way I have to come and teach all how to do that and that. You understand? Anyway, let me take a quick break and we will be back shortly. And remember, for those of you who have not yet done so, please go ahead and share the business.
Give some love with trend. Bringing love for you this game. Communion showing that we can. With gifts of love with trend.
We're bringing you gifts of love with cheer at the communal. This Christmas, we are your Santa. It's all about sharing the warmth of this season with those you love. Get in on this special loan, taking advantage of great interest rates with no principal payments until January 2022. Share the gift of love. Make it a merrier Christmas with the communal. Exciting prizes for members throughout the promotion. For we are your Santa this Christmas. Offer ends January 31st, 2022. Lending terms and conditions apply.
Communion showing that we can. With gifts of love with trend.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen, Guess and Klein and G-Shock, all at the best prices in Grenada. We also buy scrap gold and offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit our brand new remodeled store or call us on telephone number 414-3114, 232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Rich, smooth, delicious, and packed with vitamins that could only be one thing. It's Rika Almond Beverage. Great on its own or a lovely addition to smoothies. So call superb distributors on 435-2948 or visit us at Tempe St. George's today. Remember, Rika is life and life is Rika.
The Housing Authority offers products that people can choose from, products that people can access, and I think anyone looking to build, just call the Housing Authority of Grenada. The service was superb. Every step of the way, they collaborated with the owner, they collaborated with the builder. The builder himself was really good. For what I've seen them do, I have to say that from buildings they have done in the past to where they are now, they have come up to speed with modern trends, modern designs, and I think I will advise anybody to choose the Housing Authority of Grenada.
Well, that was easy. Getting what you want now. At Courts, you can find appliances, electronics, and furniture that you need at the unbeatable prices. Save up to 20% off the essentials. Get it now with Ready Finance and get 2 months free. Only at Courts, bringing value home. Special conditions apply. Promotion runs till January 31st, 2022.
We enjoy the luxury of a quality water supply. But it can come to this. Have adequate storage.
Ministry of Health to increase community testing to curb the further spread of COVID-19. We'll have details to this story and more in the national report. With the details to the news for Wednesday, January 19th, I am Rikisha St. Louis. More emphasis will be placed on community testing as the Ministry of Health records a steady increase in COVID-19 cases. 239 positive cases were confirmed on Tuesday, bringing the total number of active cases to 3,346. On Wednesday, the Ministry of Health announced the discontinuation of routine testing at the Maurice Bishop International Airport, as the majority of positive cases are being recorded locally and not at the ports of entry. Acting Chief Medical Officer Dr. Sean Charles explained that it is more prudent to fight the disease where it is occurring within the communities. Increased testing at community health facilities will lessen the potential spread of the virus and reduce the proportion of infection coming from communities.
This is a disease that is in every community in Grenada. This is a disease that is affecting almost every household in Grenada. All right? So it is not that it is spreading in schools and not spreading in churches. All right? It is not that it is spreading on the bus and not spreading in the home. All right? The disease is everywhere. So at all times, we must adopt behaviors, bearing in mind that the disease is everywhere. Where this disease spreads mostly is in the home and in those places where persons flaunt the rules. All right, so at home, like I say, we all come from different places and we converge, and I don't think that there are anyone wearing a mask around their family member. All right, so this is where the disease spreads most readily.
According to Dr. Charles, the ministry moves forward with increased testing in communities at a time when a huge percentage of healthcare workers are affected by COVID-19. He said staff shortage has and will continue to affect community health services. However, measures will be put in place to prioritize COVID-19 testing.
When persons fall sick, or when we simply do not have the adequate number of staff to cover all of these services, it puts a lot of pressure on the remaining staff to maintain some level of service. All right, and with the huge demand for testing, it's putting a lot of strain on our community staff. And, that's why we ask for understanding from the public. When you go to a testing site, and yes, there's a long line. There's a reason for this. If we had a large complement of staff, of course, that line may not be so long. But you need to understand that we are working under, a bit of pressure right now. And, we recognize and we applaud the staff who remain for the amount of work that they're able to put in, because the number of tests that we are doing right now is far exceeds anything that we have done in the past in such a short time.
Acting Chief Medical Officer Dr. Sean Charles calls on private and public health care providers to use their influence to encourage an increase in vaccination acceptance. Grenada recently participated in a regional survey on vaccination hesitancy, which revealed that persons who spoke to their healthcare provider were more inclined to get vaccinated. To date, over 36,000 Grenadians are fully vaccinated and 5,795 are partially vaccinated. Dr. Charles told members of the media on Wednesday during the post-cabinet press brief that the Ministry of Health will be depending on the wider healthcare community to help influence vaccination uptake.
What we want to do is speak to these physicians and say, listen, try to set aside a moment in your encounters with each patient and have a discussion with them with regards to vaccination. All right, you are able to analyze the evidence with regards to the effectiveness of vaccination, and you will be able to calm the concerns, all right, in the minds of your patients. So we particularly took note of that, and that is one of the first steps. We want to encourage our healthcare providers. You still have some sway in the minds of patients, and we believe that you can assist us greatly in ensuring that persons make the decision to get vaccinated.
Increasing the reach of its education and promotional campaigns is also part of plans to encourage more people to get vaccinated.
It informs our decision on how to approach the issue of vaccine hesitancy. We need to provide more avenues for persons to be educated. We noted that in the survey, persons who spoke to their healthcare provider were more inclined to get vaccinated. The Ministry of Health has been doing its part to, put out information there and educate persons. But we do know that the level of acceptance of that message has not been the best.
The vaccine hesitancy survey was conducted by the Caribbean Development Research Services cadres on Grenada, St. Lucia, Dominica, St. Vincent and the Grenadines, Trinidad and Tobago, and Barbados. This is the National Report. The news will continue after the break.
That's it. Tonga. All right, big more say moving out. Let's move now. I took my best shot to keep Grenada moving. Driver, let's move.
A message from the Ministry of Health.
Welcome back. Organizers of the Republic Bank Spice Island Billfish tournament are promising to execute an event that everyone will enjoy while being assured of their safety. There was no tournament in 2021. The tournament returns this year as a vaccinated-only event with strict adherence to COVID-19 protocols and procedures established by the Ministry of Health. It will run from January 25th to 29th. Chairman of the organizing committee, Nicholas George, says in the midst of what they expect to be an enjoyable event, safety is paramount. He outlined the schedule of events.
All participants have to be fully vaccinated. It's mandatory for access to the docks and access to the bubble that we have created at the GYC. Individuals have to be fully vaccinated. We have structured the bubble in a way along with GYC management where individuals who are within the bubble are relatively safe. But in the same breath, individuals can still have access to look at the weigh scale, etc. But we're giving participants the comfort that they can participate in the event and be in safe zones within the GYC. Historically, we've done gala prize givings. Unfortunately, due to the current situation, we really cannot execute that and we have to be safe.
Mr. George said local vessels, as well as vessels from Martinique, Barbados, Trinidad, and other Caribbean islands already registered for the tournament.
We've run a very successful local tournament, which incorporates all the fishing depots within Grenada, Carriacou, and Petit Martinique. It has become very popular. We have a major sponsor there, that's McIntyre Brothers, Systems Paint, etc., and they make it attractive for these local fishermen. We will be awarding winners from each parish, and we will be awarding the top 3 overall, winners overall. And what is special this year is we're incorporating the prize giving for these local fishermen into our main prize giving at the Yacht Club. So their awards will be presented first, and then the awards for the actual Billfish tournament will be presented. We're just seeing more unity now as compared to before when it comes to the local fishermen and it comes to the larger tournament. They look forward to it because they're now part of it, and this is something we need to keep up going into the future.
In an effort to encourage the involvement and participation of local fisherfolk, the activities of the tournament include a local inter-parish fishing competition organized in collaboration with the Department of Fisheries. This local outboard parish competition takes place on Thursday, that's tomorrow, January 20th. Continuing the news, health officials remain concerned about the slow pace at which the daily doses of COVID-19 vaccines are being administered. So far this year, the Ministry of Health administered 3,182 doses of vaccines. Dr. Sean Charles, Acting Chief Medical Officer, is hopeful that the number of fully vaccinated Grenadians, which has been at 32% for a few weeks, will improve as more tests are conducted and more people become aware of the benefits of vaccination. Dr. Charles said the ministry has been recording weekly increases in testing, with 7,301 tests done in December, and so far in January, 22,224 have been conducted, and stagnancy in vaccination numbers.
The vaccination numbers are concerning to us because Basically, we are seeing a very, very, very slow uptake of vaccines. So far for this year, we have delivered 3,182 doses. But of this, first doses are 671, second doses 575, and boosters 1,935. What does this mean? It means that relatively few persons, all right, are coming forward to get their first and second doses of vaccine, and the persons who are convinced of the benefits of vaccination, these are the ones that are taking the opportunity to ensure that they stay protected.
Low vaccination rates have also been recorded among hospitalized patients at the General Hospital. 12 patients are currently admitted, 6 with COVID pneumonia. Among them, 4 are unvaccinated, 1 fully vaccinated, and 1 partially vaccinated. There are 3 admitted on the maternity ward and 3 isolated at the Mount Gay Psychiatric Facility. There are currently no COVID-related admissions at Princess Alice and Princess Royal Hospitals. Finally, in the news, the Grenada National Food and Nutrition Council, through support from the Food and Agriculture Organization and the Ministry of Agriculture, is in the process of strengthening its food bank initiative, a project that is instrumental towards the establishment of the National Parliamentary Front Against Hunger Secretariat. Under the project, the Food and Agricultural Organization is working with the GFNC to develop a strategic action plan that will allow for the food bank's expansion, an initiative that supports vulnerable families monthly with nutritious, locally produced foods as a means of promoting healthy eating habits.
We have created multiple vouchers. We have formed collaborations with Andal and Associates as well as the Marketing and National Importing Board. Each voucher is valued at $75. At the back of the voucher, there's a list of approved food items. The council has chosen items that we believe are nutritious while also local. So this initiative will benefit our farmers as well as the beneficiaries. Persons are required to present their ID cards, walk with their vouchers, and they collect the food items as long as it's approved on the list. Our beneficiaries are primarily antenatal women, elderly persons with chronic diseases, as well as persons who the Food and Nutrition Council already supports on a monthly basis. We do know that with poverty, it's difficult for persons to eat healthy food, so oftentimes we end up purchasing whatever we can afford. So we're hoping that with this initiative, persons are encouraged to eat healthy.
Vouchers, according to Frank, are dependent on the number of residents in the household.
The number of $75 vouchers that a family receives would depend on the size of the family. So larger families would receive up to 6 vouchers, and then the smaller families 4 vouchers. So as you see, that can go quite a long way. 75 by 4, you have $300 worth of food. Our intention is to keep this project going. However, not on such a large scale, but we have a consultant that is working along with us to look for donors, sponsorships, collaborations with different local businesses to help to keep the project running and to support our vulnerable people while also trying to empower them in different ways.
The Food Bank Initiative also contributes to economic activity by supporting local farmers and producers, while at the same time improving the appreciation for local food and the nutritional benefits. The interventions under this Food Bank Initiative are consistent with the UN Sustainable Development Goal 2, which relates to the ending of hunger, achievement of food security, and nutritional improvement, along with promotion of sustainable agriculture. 130 families are expected to benefit from this initiative. These include antenatal, GFNC low birth rate babies, low-income families, the elderly, and persons with chronic diseases. That story just ended the national report for Wednesday, January 19th, recapping the top story. Ministry of Health to increase community testing to curb the further spread of COVID-19. On behalf of the entire news and production team, I am Rakisha St. Louis saying thank you for joining us. Until next time.
Thank you very much. And of course, what we have for you now is the weather. We have not seen yet the dashboard. All right, we just checked. Okay, so for the weather, we see that the weather is expected to be tonight partly cloudy and breezy with light to moderate showers after midnight. The minimum temperature 24.5 degrees Celsius, winds east-northeasterly to easterly at 14 to 24 miles per hour. Seas moderate with waves 5 to 7 feet in open waters, and the high surf advisory is in effect for the west coast. And we expect that low tides will be at 11 p.m. tonight and will be high at 5 a.m. Now going on to Thursday's weather, the sun is expected to rise at 6:33 a.m. and set at 6:04. The weather mostly fair and windy with light to moderate early morning showers. Maximum temperature for tomorrow, God's willing, 30.5 degrees Celsius and the minimum 24.5 degrees Celsius. Winds east-northeasterly to easterly at 15 to 25 miles per hour, gusting higher at times. Seas moderate with waves 5 to 7 feet in open waters. And a high surf advisory is in effect for the west coast. And we see here now that we have the dashboard coming into us. So let's see what the dashboard says, all right? So, there were 280 new cases of COVID-19 identified today. Again, 280 new cases of COVID-19 identified today. And in terms of tests done, 1,336. Sorry, 1,036. 1,036. So we see so we had less tests done, but more cases. So of course the positivity rate will shoot up just a bit. So it's now out at 27%. All right. But there's been a lot of recoveries, 670 recoveries, all right? Again, 670 recoveries. So that takes our active cases to 2,956. Again, active cases, 2,956, and there were no additional deaths, okay? So as it relates to hospitalizations, 6 persons are currently hospitalized, all right? And so that's the info we have for you as it relates to our dashboard. Again, 280 new cases of COVID-19 identified today. All right, and so you see, it's still very high numbers, very high numbers. All right, so please be guided accordingly. All right, and here we have now Sandra. We want to say hello to Sandra, hello to Michelle, hello to Ansha, hello to Charmaine, Miriam, Javar, Michi, Claire, Theresa, Charmaine, blessings to you, and everyone else who's on the program, all right? We even see that there are quite a bit of you on YouTube. Let me pick up the people on YouTube now, man. So we see we have on YouTube, my mom, always the first. We have Velma, Suzanne Worm, we have Glenora, and everyone else on YouTube, mommy, typing up and thing, on YouTube, and those of you who are watching on the big screen. So the big screen people, big up all yourself. All right, Cynthia, blessings to you. Ventress, Jacinta, how are you? Blessings to you as well, Jacinta. And we still want to encourage you guys to please donate towards our cause to help a family. Friday will be the last for that. So we are asking you to please give me a call or drop it off. So a lot of people came into the radio station the other day and dropped off their donations. All right, we are trying to raise at least $4,000 to help this family. I mean, I don't even consider not meeting the target. Right? We are not close to the target. We have up to Friday. So I'm saying that we have to. I mean, we just have to. So we need to do what we have to do. So you can drop off your donations at WeFM Radio, between 9 and 5 daily. And we really appreciate that. The boss is going to take a note of that and stuff like that. And then, yeah, all right. So please, we want to help this family, take care of this little boy. So please help us to do that. Okay, the target is 4,000. We are nowhere close to that. And failure is just not an option. I can't say to the family how it is. I can't, of the thousands of people that we have watching, raise $4,000. All right, and that's not what we're about. We're about succeeding at these initiatives. And so you are going to make that happen for us, all right? So again, you can drop off your donation at WFM Radio. You can put in a little envelope or something. Or for those of you abroad, you can let me know, and probably we could let one of the group members collect at maybe MoneyGram, Western Union or so, all right? We have never failed in the past, and we're not going to fail now. So we're asking you to let us, I just think we need to step up the pace a bit, all right? Because we need to help that family as soon as possible and get that child that surgery, okay? Okay, so that's where we are for now. Who else we want to big up? Nika, Ezran, okay, Glenda, Denise, Desiree, Celine, and everyone else. Thank you very much for watching. Linton and Mom, everybody, all right? So let's go. In 5, 4, 3, 2, 1, we all say, Ja! No! Blessings, people, blessings, all right? I'm looking forward to seeing you guys tomorrow, God's willing, right here on the Mikey Live program. Take care.